ready? Good afternoon. We got some good news today. First, we've early good news from our new president. We received approval for our longstanding request for public assistance for 9 counties in eastern Washington and 2 tribes, resulting from the terrible wildfire damage last year. And this financial assistance will help in rebuilding public infrastructure in Malden and many other places that have lost power lines and roadways and fencing and other damage to utilities. We still have a pending request for individual assistance to individual families in Whitman County who lost their homes or suffered property damage. But today's major disaster declaration, which we requested last September, will help get these communities moving more swiftly to recovery. I want to thank the Biden administration for acting quickly in the first couple weeks of their administration. It was a shame that the last administration failed in this, frankly unforgivable. But I'm really glad we're going to help these communities get back on the road to recovery. Now that didn't stop us. We have been working with these communities already to help them. I had a call a couple weeks ago with leaders in Malden about the assistance we've been providing in debris removal and rebuilding. We're going to continue to help these communities. We've got some good news in our effort to provide vaccination for Washingtonians. Today we have administered over 770,000 vaccinations across the state of Washington. That means we vaccinated about 10% of our residents either partially or fully. We're averaging about 28,000 vaccinations per day. This is good news. This is twice the number we were doing just about 2 weeks ago. And something I'm very happy about, we have now got capacity to exceed 45,000 doses a day. As you know, we'd set a target for that. So we are capable of vaccinating over 45,000 people a day. All we need is the doses. We need the vaccine. Obviously, we can't vaccinate people without the vaccine. But the good news is that as vaccine supplies increase, as we hope and believe they will, we now will be ready to get them into arms as quickly as humanly possible. So I'm really pleased about developing that. I want to thank everybody who's been working on this. National Guard, volunteers, pharmacies. We've brought pharmacies into the game. They've been doing a really good job. I'm pleased the administration has added to our doses, some of which will supplement the work we're already doing with pharmacies in the state of Washington. But of course, we have more work to do in this regard. We're concerned about disproportionate impacts of this pandemic. So we have been consciously trying to bring as much equity as possible to this system. We've done several things, including putting some of our max vaccination sites in eastern Washington, where we have large numbers of Hispanic folks living, and those have been tremendous successes. The efficiency and the productivity of these and making them accessible to people who have been hit heavily. Our Hispanic population has suffered greatly disproportionately, so getting more vaccines available to them is a high priority. We've also established mobile clinics and will continue to do so. And we've had pop-up clinics popping up around the state, which are more accessible to some folks that may have some limitations. We're going to continue these community clinics that are registered as providers. And we are making very significant investments in communicating information to the public, particularly communities of color who may not at the moment be as willing to volunteer to have the vaccine. We want to provide them the scientific information. So we've already spent $1 million on that effort to share information with them. We'll be investing another $2.3 million in those efforts between now and June, and probably $13.5 million during the remainder of next year to share information so that we can increase the folks in the communities of color who will use these vaccines that are safe. We want to make sure this information is as available as widely as possible, so we're doing it in 41 different language groups. So we made progress, but we got more work to do, obviously, on this score. I want to reiterate something I said the last few days, and that is we are not going to accept any misconduct regarding the use of these life-saving vaccines. And I'm referring to providers giving preference to some of their favorites for a variety of reasons. We have spoken loud and clear on this. It will not be tolerated. We believe that hospitals are no longer engaged in this practice. We can't condemn these activities enough. It's just wrong to offer special privilege in this regard. Everyone deserves fair access to this vaccine. So we will be quite willing, as my Department of Health has already said, to reduce dosages if providers don't abide by this common sense and fair stricture. And as I've said, it appears that people have got the memo on this, but I want to make sure that this is a serious issue for us. I do want to remind people that you've heard we've made real progress. We've had some declining numbers in our state, but we got to understand this is a long road. We do have varieties that have popped up that causing us concern, and vaccine supplies remain very limited. I know people are very frustrated by this, of trying to be in line to get access for the vaccine. And I know people understand that when we have 1.7 million people today who are eligible for the vaccine, but we're only receiving 100,000, 116,000 doses a week, I think people understand that the source of this problem, which fundamentally is a lack of vaccines. But as I've said, we believe that is going to increase. We want it to increase as rapidly as possible. We're excited about the prospects of new vaccines, hopefully going to be approved in the near future. I want to address some of our most important citizens, and that's our students. I'm really encouraged that we are making progress in the state in providing more on-site, in-person learning for our students. We know that, that despite the best efforts of our educators who have been heroic and innovative in doing this remote learning, there's just no substitute for in-person learning. And we know we're concerned about some of our students not being able to succeed in their highest ambitions without this in-person learning. So we're pleased that we are making progress in this regard. And I'd like to show why I believe this progress is both necessary and wise. I'll show you a map of the state of Washington. And this map, it shows three colors, but the two that are pertinent are the blues. This map basically shows what we've already been doing in the state of Washington. And what we've already been doing in the state of Washington very successfully is having in-person learning for many of our schools and many of our students. So we have already, in the last several months, had 200,000 students have either full or partial on-site instruction for elementary schools. And what this map shows is how extensive this is. In the light blue on this map, these are all the locations where we have had full or partial on-site instruction for significant portions of our elementary school population. Basically where we have on-site learning going on to significant degrees. The yellow areas had not reported to us, but you'll see the blue is a very extensive geographic area. It's most of the geographic part of the state of Washington. The dark blue represents the areas where students have been denied on-site instruction. So we have about 200,000 students who have already been enjoying on-site instruction in the area designated by the light blue. So we have a very good way of knowing whether this can work in a safe fashion or not. And what we have found is it is very safe because we have, of those 200,000 students, we've had very minimal in-school transmission. And yet we've had very good education because of our tremendous educators. Most of these districts have also allowed a remote option for parents who wanted to continue having remote learning. So it's a kind of situation where it's a win-win for everyone. Students get on-site learning. Parents get to make decisions whether how the education works for their children. very low transmission rates and great progress for our students. So what is happening now is that educators are listening to these success stories, and there are, I'm pleased, quite a bit of activity going back to on-site learning, and I want to thank educators for being willing to consider this as an option. The science is also pretty clear on this. Yesterday, the CDC director agreed with this approach and made reference to the data that supports this. This has not been unique to the state of Washington. The data has shown similar experience in many states, Wisconsin, Mississippi, and other places where it's been determined that actually your students might be safer in the classroom than out on the streets as far as exposure to the COVID virus. Just a little story about what I think is going on out there in the state of Washington. Educators, like all of us early in this pandemic, have had real concerns about this and real concerns about whether or not it could be safe to go back to on-site instruction. I talked to a math teacher at Elk Ridge Elementary School yesterday, the day before yesterday, and he told me that when this was being considered at his school, this is elementary school in Buckley, he said he really, really doubted this could work. And he went over to Yakima and visited I believe it's a high school, and saw how they were doing it with on-site instruction. And he said it was just a real eye-opener for him, because he figured out that when you go to a hybrid model, meaning you have sort of half students at one time or another, so you have half as many students in the school, you really can spread out. You can do things to cohort students, and the students really mask up. It's pretty impressive what the teachers will tell you is that the students are really good at wearing their masks. So he returned back to Buckley and has now been involved in a very successful effort at Elk Ridge Elementary School. In fact, it was pretty interesting. I picked up a little tidbit here and there. When the school started to go from the remote back to on-site, they were concerned that they wouldn't get enough teachers to be willing to go on-site. In other words, to leave the remote and go to on-site instruction. It was because of the teachers' concerns. It was actually the opposite. They actually had to convince teachers who wanted to go on-site to still provide some remote learning for those families that did want to maintain the remote learning opportunity. So I think what we're seeing is the justified and understandable concern about safety early in the pandemic being replaced with confidence builders of schools and educators and bus drivers and cooks who have demonstrated the ability to use these protocols in a way that is safe. And that's happening across the state of Washington. I'm very pleased about that. I hope will be accelerated. And I hope people will talk to their fellow educators. I hope they will look at the science on this, some of which I've provided, so that we can really give these students what they need, which is a good, to the extent possible, on-site instruction should they desire it. And I hope that that will continue. I know there's issues of vaccines. We would all like to be vaccinated today. We are going to be vaccinating teachers. We are already vaccinating teachers, those who are over the age of 65, and those who are over 50 who live in multi-generational housing. But there isn't enough to go around for everybody who's not of age right now, and we look forward to getting everyone who's an essential worker vaccinated in the next tranche. Not just teachers, but other essential workers, grocery store workers. Look, we get food because checkout folks at the counter are willing to work. We ride buses because bus drivers are willing to work. And we want to get those people vaccinated as soon as we can. So I'm really encouraged from what I'm seeing. The evidence has backed up what our excellent educators are doing, and I hope that that will increase. A comment on one of our big days in American history, the Super Bowl. We want to make sure that when the Seahawks go to the Super Bowl next year, we have all the 12 mans available. Nobody's lost their lives due to COVID. So we're really hoping people can be on that Seahawks team and being safe and careful on Super Bowl Sunday. We know this is a tradition to have a whole bunch of people yelling in the same room, but that's really too dangerous this year, and we are encouraging people to protect themselves Super Bowl Sunday. There ought to be a way, do it in a way where you're with your pod or your family and maybe not have so many people and breathing so closely, and masks really help too. So I hope people can take care of themselves. I want to thank the Seahawks who've spoken out on this. They have, by the way, they kind of won one Super Bowl. That was the only team that didn't have a single COVID case this year. Congratulations to Coach Carroll and the team that saved the health of the Seahawk players. I also thank NFL Commissioner Roger Goodell. I spoke to him yesterday, and he has helped spread this message of be safe. So we can keep going to Super Bowls. I hope people do that. I have Dr. Shah. Well, just wanted to comment. Look, this is just really simple. We don't want to let the virus win the Super Bowl. We want to win the Super Bowl, and that means keeping people healthy, and I hope people can focus on that this year. We have Dr. Shah. Dr. Shah, you can make some comments about our mass vaccination efforts?
Sure, Governor. Thank you. Can you hear me okay?
Yes.
Great. So my name is Dr. Umair. Shah. I'm the Secretary of Health for the state of Washington. I want to just first of all thank Governor for all the leadership and the comprehensive remarks that you have made about where we are with COVID-19. I do want to also join you in talking about the great progress we're seeing with vaccines across the state of Washington. As the governor mentioned, as of yesterday, we have vaccinated over 700. We have delivered over and administered over 770,000 vaccines in the state of Washington, and so that's vaccines in the arms of community members. And at this pace, we are well on our way to continuing to increase the numbers moving forward. We've also gotten faster at doing that. Our 7-day average, as the governor mentioned, is now over 28,000 vaccines administered a day. And 2 weeks ago, that number was in the 13 to 14,000 range. We have built capacity, and when supplies are available, we can even, vaccine supplies are available, we can even get closer to our goal of vaccinating 45,000 people every day. But I do want to just emphasize what Governor mentioned, which is that we have built the capacity already to administer 45,000 vaccines a day, but we're now waiting to get that additional supply of vaccines. The mass vaccination sites are a big part of why we're seeing such important and significant success. After opening last week, more than 15,000 people, that's 15,838 people, got vaccinated at one of the state's 4 sites in Spokane, Ridgefield, Wenatchee, and Kennewick. And Governor and I visited down in the Clark County area just last week together, and we had the opportunity to visit with our Guard partners, but also with others on the ground, including Safeway. We're also supporting the local health department efforts in the Puget Sound area for their mass vaccination efforts. We want to really offer a heartfelt thank you to our partners on the ground, as well, Washington National Guard and our local and private sector partners who are all working together every single day to vaccinate as many Washingtonians as possible. We love the progress, but we recognize that the problem we're still running into is the demand for vaccine, unfortunately, is outpacing the number of doses we are getting into the state of Washington from our federal partners. We know that is going to improve in time, and so we want to continue to ask for patience from our community members. We also know that the spread of limited vaccine supply is important to get to sites across the state to help people have easier access to vaccines, and that's why we stood up these 4 mass vaccination sites. But in addition, it's important that we also, and we are doing this, is spreading the vaccines into pharmacies, community health centers, local public health partners, our tribal partners, and of course the mass vaccination sites as well. Every week when we get vaccines and the allotments into the state of Washington. That also includes our healthcare partners, and so we do want to thank our hospital and healthcare partners, but we want to recognize also the incredible work in expanding to pharmacies, community health centers, and public health partners across the system. As the governor mentioned, while speed is absolutely important, and we have put together under Governor Inslee's leadership the Vaccine Action Command and Control System Center, and this is a public-private partnership that really is about throughput, efficiencies, effectiveness, and really assuring that we get as many people vaccinated as possible, harnessing the power of the private sector. Just yesterday, we convened our first vaccine implementation collaborative. These set of collaboratives, what I call the BICs, is really about equity. It's balancing the throughput and the numbers with dialogue, feedback from stakeholders, which is absolutely critical as well. The governor also mentioned that we, as you all know, we have put in place that providers have to administer 95% of their allocations within a week. We did have providers, unfortunately, that we had to reduce vaccine numbers from the week before, allocations from the week before. I will say the vast majority of our providers have been just fantastic about just being able to get the vaccines into the arms of their community members, and I just want to thank them again. So let me close by saying our message to the people of Washington right now is patience. Please have patience. We know it is difficult right now, as the governor mentioned, with just the number. It's a numbers game in terms of the numbers of vaccines that are coming into the state compared to what what the demand is for vaccines. But your turn is coming. Please continue to go to our Phase Finder tool on our website, and also additional information on where you can get vaccine in communities. We're continually working on ways to improve the information on our website and also through social media. We also want to thank providers and our healthcare workers who are working each and every day to get the people of Washington vaccinated. I've had a chance to visit smaller communities, larger ones, urban, rural areas, in the Puget Sound area and beyond. And next week I plan on visiting Eastern Washington. We offer a heartfelt thank you to all of you. The hours are long, the work is challenging, the supply is not sufficient to meet needs. We know that, but the effort we've seen across the state to get people vaccinated, from small clinics, pharmacies, hospitals, to mass vaccination sites, has been incredible, and it's been inspiring. So this is the Washington we know, and the spirit we've come to count on, and the legacy we want to leave behind when COVID is behind us. I do want to just finish by emphasizing the message that the governor made mention of with the Super Bowl coming Sunday evening. We do not want people to sink back into actions or activities that are going to put them or their loved ones at risk. We do not want to see a surge 2 weeks from Super Bowl Sunday. That would be terrible. And so we would ask all of you to do everything you can to get that message out, to make sure you protect yourself and your loved ones, and to celebrate safely. With that, Governor, that's all I have, and I want to say thank you to you, and I'll turn it back.
Thank you. Just a comment on what Dr. Shah said. He gave us he's a physician, of course, and he's given us advice, which is to be patient. I just want you to know that we are not patient in our administration. We are impatient. We get up every morning trying to drive this ship faster every way we can, because we want to get people vaccinated as fast as humanly possible. And because we've had that driving ambition, we are making progress. I want to show you, just so you'll have some sense of that in the state, another graph that shows where we are relative to other states. Obviously, everyone wants to do this in the state of or in the United States. This graph shows where we stand as a percentage of the doses that have been delivered to us as to what percentage have actually gotten people's arms. The graph at the top left, the yellow bar, shows we were on January 19th. We were about 33rd or 34th in the United States. That was unsatisfactory to us. We always want to win the Super Bowl. So we got busy bringing a whole bunch of new systems in place. And the next graph over to the top right is where we stood on January 26th, was right in the middle of the pack, about 25th or 26th. We continued our efforts, and now where we are as of February 4th is the graph on the bottom, where we are now 14th in the United States as far as our percentages of doses delivered, and we have ambitions to rise, of course. This has happened because of people really putting their shoulder to the wheel and pulling on that rope, and we got to continue to do this. But We can't do it without the vaccine. That's why we need to accelerate the production of the vaccine. I'm glad we've got a new president who gets that. He's taken some strong action. I'm pleased to see it. We got a good working relationship, but all of us got to pull for that production. With that, I want to make a comment about some legislative actions. This week, legislature passed legislation that will provide some really important relief to businesses that have experienced a hike and a spike in their unemployment rates because of the COVID pandemic. Obviously, none of these businesses could have known the potential impact of this pandemic months ago, and they shouldn't have to face unnecessary additional burdens because of it. So Senate Bill 5061 both increases the minimum unemployment benefits for workers, and it provides $1.7 billion in unemployment tax relief for businesses. It passed with strong bipartisan support. I think it's a win for everyone in the state of Washington. I haven't received this legislation yet, but once it's on my desk, I hope to sign it Friday. Before I take your questions, I know there's a lot of concern about the breach that occurred at the auditor's office. If you are concerned about that, and if you want to take proactive steps in response to any potential identity theft, resources are available at the state auditor's office, and they can be reached at sao.wa.gov, sao.wa.gov. And we are directing you to the auditor's office because that is the separate agency that has control of both this information and the state's response to it. There may be some additional information available at the Office of Financial Management website, ofm.wa.gov, ofm.wa.gov, and on the State Department of Financial Institutions website, D as in dog, fi.wa.gov, dfi.wa.gov. We are also looking forward to the auditor's office being able to provide individual notification to the individuals whose identity may have been compromised. They are engaged in an effort to deploy a system of doing that. We're hopeful that can happen as soon as possible to get individual notification to the individuals whose data may have been compromised. So with that, I'll stand for questions. Dr. Shah, Lisa Fehrenbach, and Nick Struley are also here for questions. Fire away.
First question comes from Rachel with AP.
Democratic lawmakers say their counties are being unfairly held back in the regional reopening plan because of the region they were assigned to. And earlier this week, Whatcom County sent you a letter calling your plan inequitable and saying that the metrics are not justified by science. Has this pushback made you rethink your approach? And if not, what are you telling these counties who are seeing lower case counts than others who have already moved on to phase 2?
Well, we always listen to these insights and critiques, and the reason is that constantly trying to improve our processes, but we're not making changes at this moment because I think what we've learned is that our approach that very much is based on science, it's based on the belief that we need to make reasoned decisions as we reopen our businesses. Now, before we lose the forest for the trees here, let's note that what we did was to open up about half the state of Washington. So we allowed businesses to go to a heightened level of activity for businesses that represent about half the population of the state of Washington. This is a big step forward. We're very happy to be able to make that. And we made that decision based on the science, on the data. This was not us throwing a dartboard at the wall. We established metrics of how these regions were doing. And that's based on hard data and hard science, not on any emotional response. And then we had metrics of performance. And basically, if these regions were making improvements, then they moved forward based on the science and the data. About half the state met those metrics of improvement. We're very, very happy about that. About half the state did not. But those regions still are eligible to reopen as soon as those metrics improve. And I'm looking forward to that happening. Now, the fundamental thing we're doing, if I may, I know this is very, very difficult for people, particularly businesses that have been impacted. It is very difficult to think the businesses are still having trouble who may not be able to have indoor dining, for instance. We've been impressed with the innovative talents of a lot of restaurants who've figured out a way to provide good services to people, but this is still obviously a huge handicap for them. We want them to be able to move forward. But look, we've made some decision in Washington State, and that is we're going to save lives as our highest priority, and we have saved lives. I've talked with you many times. Thousands of lives have been saved because we have taken a science-based approach of reopening our businesses as we get to a position where that is safe to do. Now, we were able to take this step because we are having some improvement right now. But we are not going to go backwards and join these other states that in the rush to base non-science decision-making, they end up having thousands of people die. That's just not the Washington way. We're 5th in the country, and we're going to continue to save lives in the state of Washington. Now, I will note that when I say this is based on science, it's just based on data and their regions as they improve their performance. As we get a break from the pandemic, as more people wear masks, as maybe they're careful on Super Bowl Sunday, and those metrics improve, those regions will be able, as soon as possible, to reopen. So no, I think this is as fair as humans can design. I know there's criticism of them from any part of the compass, but if we're going to save lives, some of this is simply necessary.
Next question comes from Joe with the Seattle Times.
If I may, too, excuse me, Joe, excuse me, I just thought something else, too, I should really share with Rachel. I know there's been some people who have been critical of the approach we've taken because instead of being based on static information, in other words, just kind of a snapshot of where you are, we've based it on looking at the dynamic conditions in the region. Dynamic meaning, are you going up? Are you going down? Have you plateaued? We think this is the best system of evaluating the real risk of what's going on in the pandemic. And if you're in a dynamic situation where you are going down to some considerable degree, that's when we think it's safe to start this reopening process. And I think that is a scientifically sound approach.
Go ahead, Joe.
Yeah, Governor, to hit your target on daily vaccinations, I think you have to have something like 315,000 doses coming in from the federal government per week. When do you reasonably expect that to be happening?
You know, I just hesitate to make any predictions because this is obviously out of our control in the state. I can convey to you what we've been told. The Pfizer and Moderna companies, well, let me stop that. I know Pfizer. The Pfizer company told us they believe they could double their production in February compared to January. And they believe they could double their production again in March. You know, if those conditions were met, if Moderna matched that degree of production, you might get to that point in March. But there's big ifs in so many different ways. I almost hesitate to mention any particular date. So that's the best I can pass on to you, to Joe, and I know we're all pulling to go as fast as we can.
Next question comes from Austin with Northwest News Network.
I do want to reiterate, I'm sorry that maybe this is a little repetitive, but I do want to make clear. We are capable of meeting our goal today. We can easily do 45,000 vaccinations today. We have the vaccinators, we have the logistics, we have the pop-up tents, we have the hospitals. We can do that today. It's just that we got to have the vaccines. So that's the good news. When we get the vaccines, we're going to accelerate this dramatically.
Governor, this is Umair. I just wanted to add, and by the way, my camera is not working, so apologies for that technical issue earlier. As the governor just mentioned, just to add a little bit of additional information, of the 100,000+ vaccines that we're receiving, first dose vaccines we're receiving on a weekly basis. This past week, we had requests for 358,000 of those vaccines from providers who are ready to provide those vaccines to Washingtonians. Unfortunately, we just don't have enough vaccines coming into the state. Governor as well as Department of Health, we have been doing everything we can to have the discussions with our federal partners, and they are giving us more and more information every day, which will give us more insights into what's happening down the road. But again, as he has said, absolutely, we want to shy away from making those predictions because there's so many uncertainties from that federal standpoint.
Austin, go ahead.
Austin, you're up.
Yep.
You might
Okay,
be
can you
muted
hear me?
there. Yes.
So just following up on Rachel's question, it seems like some of the heartburn is with the regional approach rather than the county by county approach. And I know you were looking at hospital service regions and capacity, but even some of the public health officials in some of these smaller counties are saying, to quote them, this is insane. So I'd like you to just address that specific piece, the regional approach. And related to that, I heard a proposal today that why don't you, at least for purposes of reopening or going to phase 2, do a week-to-week analysis rather than every 2 weeks, so that it's maybe a region that's ready now, ready on Friday, could open on Monday.
Well, first off, I want to show my respect for the CRITIS plan. There are 10,000 legitimate criticisms of what we've done here, where we've drawn the lines, how fast we've set the metrics, how often that we look at. I could give you 100 criticisms of the plan that we've proposed that have some legitimacy and some argument. So those who've argued that a county approach would be better, I understand those arguments. They have some resonance with me. The reason we did it this way is twofold, some of which not everybody thinks about, but we have to think about everything, not just our little narrow looking through the keyhole here. There's two reasons for this. Number one, we have now added a metric of the dynamic activity in hospitalizations and ICU capacity. And because our medical systems are not limited to counties, they are interwoven amongst counties, where they share. One county will frequently send its hospitals to a different county with different medical, frequently higher level of care. If you're going to have that type of metric, it makes sense to have a regional approach that is more consistent with the healthcare catchment basins of your healthcare system. That's number one. Number two is that when the smaller units that you choose to make these decisions, the more complaints you get from people saying, geez, I'm right across the street and that restaurant opened, how come I can't? So if you go to a county-based system, you might close the restaurants in Benton County and open them in Franklin County, a half mile away. And that doesn't resonate well with people either. And if you did it on a countywide basis, I can assure you that we would be criticized for that, of having such insane restrictions for two restaurants on two different sides of the street. So I think there is a rational reason why we have done this. But again, I want to respect people's right to give us some insights. And as time goes forward, look, if we find a better way to do it, we'll take it. On the issue of the time period, we've attempted to provide some degree of stability to the system. So because we're doing this based on a dynamic process, we thought it's better to have the 2 weeks, because 1 week you might just have a bad week or a bad couple of weeks. And so this reduces the chance that we just had sort of an aberration that might knock you down a peg. This cuts both ways, if you will. So if you have a bad week as a county, now it's less likely that you have to regress. So that's the rationale. But look, I'm sure there's arguments for 1 week. I'm sure there's arguments for 3 or 4 weeks. We thought this was a reasonable approach.
Can I see if Nick has anything to add?
Yeah, Nick, you got any insights?
Governor, I think you did a terrific job answering the question. The one thing that I would add, especially when it comes to the regions that we're using for determining the reopening, we relied heavily on on the emergency medical services regions. And I know that was mentioned in the question, but I think it's important to call out and emphasize that those regions have existed for decades and have worked well for coordinating the emergency medical services within those regions. And that's a big part of the reason why we thought it was so important to leverage those long-standing existing regions for the most part when we crafted our reopening plan.
I want to thank Nick for recognizing the brilliance of my answer, too. We've got some of the best yes men ever in the state of Washington here, too. Thank you, Nick, for your work.
Next question comes from Keith with Como 4.
After this same question, you've got in Washington County, it's not just restaurant owners, it's the county health board and the health director there. These are professionals and people who know about these statistics. They're still asking you to back off on this regional approach and allow them to get to phase 2, that they still don't believe it's fair, and you have basically the tale of two states.
Well, we'll continue to listen to their observations. I think I understand their arguments. But look, we're a very diverse state. I represent 7 million people. What I can tell you is that I can assure you any plan we had in the state of Washington that did not fully open up the last restaurant and the last gym to full operations would be criticized. And I can assure you, if we jumped one way that has suggested by Whatcom County, and we adopted the Whatcom County approach, we would be criticized by someone else in a different county. And that is the nature of this situation that we are in. And so it is, I respect that criticism, but I'm just telling you that any other approach would be equally or more vociferously attacked. We believe it is a reasonable proposition. And in the ultimate analysis, if I may, I think it's probably fair and maybe just a little bit wise to look at the proof of whether we're doing things that are rational or really non-productive. Let's look at the proof of the results of what we have been doing in our state. And the results are extremely gratifying in that the decisions that we have made, and I'm taking some responsibility for them, have put us ahead of 45 other states. Now, everybody can have a rational argument against what we're doing, but you can't argue with the results, which is that we are ahead of 45 other states. And that means we have saved 7,000, 8,000 people in our state. So people can call us insane, unscientific, irrational, they can use whatever adjective they want. But what we're doing is working. And I think that's maybe the ultimate thing we ought to take a look at.
And Governor, if I could chime in a little bit on this one too. I think it's really important to turn back to the data as we're thinking about some of these criticisms. A number of the counties that you mentioned with these criticisms that, as the governor mentioned, are totally valid. Those regions saw almost a 70% increase in their trend for case counts during the evaluation period. Several of the regions, 4 of the regions in the last evaluation period, had double-digit increases in their hospital admission rates. And so those are the trends that we're really watching to see if those medical systems are decompressing, if their case counts are trending down, in order for us to make, for the system to make a determination about whether or not they're ready to move ahead.
So,
And Governor, if I could just add in, because the question was invoking the public health colleagues. I do want to make it clear, as Governor Nick just said, that we do respect those that are on the ground and their viewpoints. That doesn't always mean that we're going to agree. And so just as I will tell you, from a public health standpoint, there are arguments in one direction, there are arguments in another direction. And so I do think it's important from a health and medical standpoint that this is not just, coming from a standpoint of a political way of looking at things, but it's also looking at it from a health and medical standpoint. And so while absolutely I respect my colleagues in local public health systems, as you know, I've been for 18 years at the local public health level, I will tell you that at the same time, that doesn't mean that we will always agree on every single thing. And so this, as Nick has pointed out, the importance of the regional healthcare system and our real goal for making sure that we were protecting that regional healthcare system. And the fact is that people do go across communities all the time where they live and they work and do all sorts of other things. And so we really felt this was the way to go. But I do want to recognize that it's not a negative towards our public health colleagues on the ground, but I do want to say that respectfully, not always do we agree on every single way of the path forward.
So Nick, I want to clarify something. Say Whatcom County has had that, was it 70% increase? What did I hear?
I said the northern region, which includes Whatcom County, has had almost 70% increase in their trend in case counts.
Got it.
Next question comes from Sarah with McClatchy.
For Dr. Shah, on Tuesday, the Whatcom County Health Board sent a letter to you stating concern about a lack of transparency regarding vaccine distribution. They said allocation to counties isn't clearly defined, doesn't seem to be based on population or other metrics, and asking the department how the department is making decisions about which enrolled providers receive the vaccine and the quantity they receive. Can you just respond to that? And specifically, they're requesting more transparency and rationale behind decision-making be provided publicly via the department's website and to providers when sharing allocations.
Yeah, thanks for that question. And, you know, I'll tell you that we are in touch with, and whether it's with me directly or with our team at Department of Health, we're in touch with our public health partners. Again, a tremendous amount of respect and appreciation for the work that they're doing on the ground and to support the public health system across the state of Washington. You know, the reality is that we have put a lot of information on our website. We're also sharing a lot of information behind the scenes with our partners, but it's not a destination, it's a journey. It's an iterative process. And I do think that we can do a better job and improve some of the information sharing. In fact, we have worked with WASALFA, the Washington State Association of Local Public Health Officials, and their team to really talk through various strategies that we can work together as state public health and local public health, because ultimately it is public health. And that is something we're in active discussions with. And we also had a conversation just a couple of days ago with partners on the ground in our local public health jurisdictions to really have these very discussions. So I would just close by saying that absolutely we can do a better job with it. I think we've actually done a very good job of trying to get information out, but so much has been changing, so much has been happening that it is really important for us to be able to have that information clearly and concisely provided to our partners. There is a, and I've heard this from not just public health partners, but even some from our elected officials. There is an importance of sharing information, but you have to have the full context. So sometimes, for example, our partners have thought, well, the state is not giving us information on our vaccine allotments weeks ahead so we can plan ahead. And that is something that we're also finding out that information just a few days before from our federal partners. At the same time, we're also having situations where, you know, when as I mentioned with the 358,000 requests for vaccine doses, and we're getting only 100-some thousand first doses in a week, that at the same time, we only have a third essentially of the vaccines coming into the state. So there's no way that we can actually provide vaccines to everybody who would like to have those vaccines from a provider standpoint. So I think it's just important to remember the full context. And so while everybody has opinions and there are obviously concerns and as the governor mentioned, insights and critiques, from our standpoint, we want to do everything we can to share as partners that information with those that are on the ground. And so we're doing everything we can to improve those processes as well.
And if I can, look at, I haven't heard a critique yet of our proposals that we hadn't thought about and argued about internally. This issue, whether you go by counties or regions, we thought long and hard about that, about the criticisms that have just been reflected. And for some of the reasons I discussed, decided to go a different route. These are not random decisions. If I can, let me just, in a 30,000-foot description of how this system works. As far as allocation, the general goal is to save as many lives in the state of Washington in the fairest way possible, in the quickest way possible. Those are the fundamental three values that drive this decision-making. Obviously, it starts with an effort to be as fair geographically as possible. That then results in looking at all of the provisions of providers, of the multiple different types of providers. We started heavily with hospitals because it was heavily for healthcare providers and long-term care facilities. We have broadened that dramatically to include pharmacies, mass vaccination clinics, pop-up clinics, community clinics. And so we have broadened the access by bringing in additional industries, if you will, for providing that. And the department tries to match up in real time those providers to try to meet our value system of vaccinating the most people possible in the fairest way possible. And fair is both geographic, so we don't try to have unfair distribution geographically, and it is trying to reach people who are hard to reach. We know that this is a pandemic that has affected the Latino community and the Black community much disproportionately, so we've tried to do a lot of things to make those vaccines accessible to people who otherwise have had a hard time. That's why we put 3 max vac sites, or one of the reasons, in Eastern Washington. It's why we're doing these efforts like Mayor Durkin is doing in Seattle to go out to some of these communities where it is easier to access them. And it is done in real time. They spend a lot of nights, late at night, trying to match up the doses as soon as we find out what we're going to get to these providers. And it is a Herculean effort to figure that out. To date, I would encourage people who have specific questions about that. If there's something you're specifically concerned about, please send us your questions so we can get it answered. If you're a clinic and you got, less this week than another week, ask the question. So we will try to answer it as best as we can.
Next question comes from Laurel with the Spokesman Review.
Thanks. I have 2 hopefully quick questions. The first for you, Governor, about the FEMA aid. I'm wondering if you have any more details you can share specifically about the dollar amount that we've received and how quickly the counties and tribes will begin to receive that. And then my second question, probably for Dr. Shah, the Biden administration announced it will be sending vaccines straight to pharmacies, I believe next week. Do you know yet how that will fit into the state's allocation, and will DOH be in charge of making sure pharmacies don't get sent doses twice? Just any more info about that. Thanks.
We don't have any new information on FEMA. We'll share it as soon as we have some information.
Yeah, Lacey, did you want to make a comment about about either FEMA or the pharmacy situation? I did want to say that we are working with our federal partners to do a number of things on the pharmacy allocation for long-term care facilities, and there are some things that we're doing behind the scenes, working with our partners at the federal government to see if there's a way for us to earlier than later be able to move some of those doses that were earmarked for the long-term care facilities into our general allotment, if you will. That also includes obviously work in the pharmacies or work through the pharmacies. So that's happening actively behind the scenes right now. But Lacey, I don't know if you had anything else you wanted to add.
I can't, I'm sorry, my video does, there we go. I can share that we received approval for the state's FEMA request to support mass vaccination efforts. That request was $550 million. We are receiving $274 million upfront. I don't have in my brain the details of how much of that goes to the locals, but there will be funding for all 39 counties, and we can follow up with you afterwards with more details on that.
Great. Final question comes from Jerry with the Everett Herald.
Governor, I think in the future, I'll probably ask what are the metrics you use to lead you to believe the Seahawks will win the Super Bowl next year. But for today, the state did reduce vaccine allotments to 39 providers last week because they did not use their allotment fast enough. But can you tell us who they were or in which counties they were located, and if the doses that were retrieved by the state, were they given to other providers in the same county?
Dr. Shah, you want to answer that?
Yeah, so it's not as let me be clear that it's not necessarily that the doses that are in that facility or that provider are what's then transferred over, although that is happening as well. But it's that the next allotment for the following week that we then look at a number of different factors, including the ability for a provider to be able to meet the requirements of the state. And then in that following week, we make a decision on whether that allotment should continue to that singular provider or go elsewhere. So it's not, I think your implicit in your question was that transferring it over somewhere or moving it over somewhere, that's not how it works. It's that those vaccines are there, although we can transfer from provider to provider, but it's really the next allotment, the next shipment that's coming the following week. How does that, how does that play into the decisions on how much vaccine that provider or other providers would receive? So I hope that answers that question. And certainly we want to work with our providers and want to do everything we can to support those providers. But certainly there are times where we're seeing, as you mentioned, there are times where we're seeing that those some providers, very small number, have not been able to do that. And we want to then make sure that we work so that we can get vaccines to other providers while we continue to try to figure out what's going on with the ones that have not been able to administer those vaccines that are with them.
I don't know if we've made a decision yet whether to publicize who those providers are. I'll get back to you on that when we make a decision about that. We don't want to be punitive about this. It's just that we have found that some providers, don't have the capability of doing the rate of vaccination that we need. And so we have opted to go with people who are more successful. And it's one of the reasons, if you look at this chart, we've gone from 33rd to 14th in getting people vaccinated. These are the kind of hard decisions you have to make. And answer your question about transfer, I don't think there's a direct, they don't transfer from A to B. It's just that you reduce an allocation, so in a sense it goes to the pool and then it's distributed as appropriate. Fortunately, I have not heard, and again, maybe I haven't heard about it yet, but so far we haven't heard about concerns about, counties not getting, quote, a fair share. We have not heard concerns in that regard. If we do, we'll certainly be attentive to them. We heard one concern at one point, a county councilman said King County had only got 25% that week, but it turned out they got a lot more than that in previous weeks, so that King County had actually had 32%, which is almost identical to their per capita numbers. So we'll try to be as cognizant as possible. So far, it's been pretty successful.
It looks like we actually have time for one final question, which will come from Daniel with the Inlander.
Oh, thank you. I appreciate it. Right now the Department of Health isn't able or willing to share with the public how many vaccine doses they're sending to each specific facility or provider. Considering we've had multiple incidents of providers giving donors or board members early access to vaccines, as well as concerns about racial and economic equity in the vaccine distribution process, should DOH change its policy and allow the public to see how many doses each provider has received?
Maybe.
Yeah.
We'll think about that.
I was going to say a very similar answer is that we're constantly looking at ways to improve both transparency and also information to the public, but also our providers. And so that may be something that we approach. But right now we haven't been able to do that for a number of reasons, including some of the ways the allotments are coming in and just the rapid turnaround from when we get the information from the federal government to us, but we're hopeful that that's going to improve over time. But thank you for that comment.
I will, comment about the data on issue. The data administration is extremely challenging because these are people who are working literally day and night. When, as soon as they get an allocation from the federal government, they got to make very quick decisions on the reallocation. And the thing you're talking about sounds like something would be useful, and it's just a capacity issue, I suspect. But we'll think about that. Closing comments? Yep. So I just hope that we can, for a couple hours, focus on the fact that Washington State's making real progress right now. We're having a dramatic increase in the rate of vaccinating our people. We are making a dramatic increase in the number of people who are being vaccinated. We are receiving increasing supplies, which is certainly gratifying. We have now seen whole new industries come into the game, including public-private partnerships, which are quite unique in the United States, actually, that have helped us set up some of these mass vaccination clinics. We are increasing academic opportunities for our students by having more on-site learning in many, many places across the state of Washington. And we're seeing new development of new vaccines coming on, we hope fairly shortly, to add to the numbers of vaccines that have been improved. So I think it's appropriate, and we're, at least at the moment, experiencing a decline in cases. So as we work through the inevitable frustrations of limitations and scarcity, I hope people will keep our eye on the ball to make sure that we keep working together to continue this rate of progress we're having in our state. It is not easy working through frustration, but if we do this, we're going to keep heading up pretty rapidly, and that's what we're doing right now. Thanks a lot. Please be safe.
TVW examines how decisions made at the Capitol affect you, schools, taxes, healthcare, transportation, and more, on TV and online. For in-depth coverage you won't find anywhere else, watch TVW. Get more from TVW. Follow us on Twitter at TVW News and